Now, the last clinical case scenario, 60-year-old female presents with a complaint of I can't chew. And is it a wonder? The same surgeon placed those 8 different implants. I have no idea why they selected the variety of implants that they did. So, it's obvious why she can't chew. Those implants in the maxilla are failing. So, she's concerned about function, not aesthetics. She prefers a fixed prosthesis. And the restorative dentist would prefer to perform guided procedures so that she can fabricate a provisional restoration off of the surgical guide. What we had to do was clean up the area. We removed all the failed implants. And obviously, we don't have enough bone to place implants, so we had to do augmentation procedure to fill in the defects that were left because of the failing implants. Now, we proceed with guided approach to implant treatment. And as Marcus has pointed out to you, and hopefully you picked up on that, you lose all tactile sensation when you drill through a surgical template like this. And you lose all tactile sensation as far as the resistance that you get, because you'll get false readings. As you're turning these very finely precise components into the surgical template, it's going to meet with resistance just because it's so well fitted. And so you can be lulled into a false sense of security thinking, oh, I'm achieving very high insertion torque, when you're really not, because the torque resistance is being made by the highly precise components. And so now you have all the implants in. What do? Of course, take an ISQ measurement. And here was the measurement. And you can see it's all over the map. Why? Because it's all over the map as far as the quality of bone. Some implants are placed into healthy bone. Others are placed into grafted bone. And depending on the development of that grafted bone, you may or may not have very good stability. So, question number 1. Would you bury all the implants and wait the conventional healing time of 6 months, knowing that the patient would prefer a fixed restoration? Would you bury the implants with low ISQ values and place healing abutments on the stable ones to provide a stop to the removable prosthesis? Because you know, as well as I do, with removable dentures, if you put them on to the edentulous ridge, it's going to move all over the place. It's going to provide some vertical forces, loading forces on those implants, whether you bury it or not. Would you bury the implants with low ISQ values and place locator attachments on the implants with high ISQ values to provide some vertical stop? Or would you connect all implants with a provisional fixed prosthesis as the patient wants, providing her with cross-arch stabilization? What would you do? Now, this is a tricky question because it's fully edentulous. So you know if you place a fixed restoration on those implants, they're going to support some load. You can't tell the patient not to chew or not to eat for 6 months, right? So it's going to have to take some load. And so the majority of you said bury the implants or place some locator attachments to provide vertical stop. Okay. It makes reasonable sense, correct? Well, being the aggressive surgeon from Los Angeles that I am, we went ahead and provided the patient with this fixed provisional restoration. Now, I felt comfortable for 2 reasons. Number 1, if you recall, the highest ISQ values were with the most distal implants, okay? And number 2, you notice what I did here we limited the extension distally, so there was no distal cantilever. And so all of this load is supported by these 1, 2, 3, 4, 5, 6, 7 implants. So they're all connected together. Yes, it's not a solid connection because this is a acrylic prosthesis, but it's all tied together. So the question here is, how long would you wait? 2 months, 4 months, 6 months, or 8 months with those measurements? You all better say 6 months. I waited 5 months. Just because this patient, not because I'm honorary, but the patient flew in from Japan, so she wanted me to test these implants. So we removed the prosthesis, and lo and behold, those were the secondary measurements. Now, if you look straight up above, you see that the 25 ISQ has gone up to 58. You see the 25 in the front implant has gone up to 62, and the 25 on the number 6 implant has gone up to 50. Whereas the solid implants, 76, has dropped down to 70. We did not take an ISQ value on that wide platform, but nevertheless, at 5 months, it was 60. And so this gives me a good feeling for what is going on with these implants. Now, at this point, do you want to go with a definitive restoration? The obvious answer is the numbers are going up. I would proceed with fabrication of the definitive prosthesis. Wait another month to take a third ISQ reading on all implants. Wait 3 more months to take the third ISQ reading, or let the patient wear the fixed provisional for a full year before taking another ISQ reading. What would you do? Knowing that all of the numbers have gone up, you have now included the pterygoid implant, so now you have 8 implants. Do you feel confident in going forward with a definitive restoration? And the majority of you said, wait 3 more months. Now remember, that was at 5 months. When do you typically, without taking readings or without measuring insertion torque, how long would you wait? 6 months, right? So we waited almost 7 months. And so here was the next ISQ reading at 6.5 months compared to the 5 months. And you see, very little change has occurred. Now, what this tells me is at this time, these implants have reached the steady state. And if you wait longer, it's not going to make much difference. Because once it has achieved that steady state, now you're loading these implants, you're getting the turnover of bone around the implants that you want, and you are assured that these implants are stable. And so at this point in time, we would go with the definitive restoration. Okay, so again, hopefully you see how I'm using successive measurements to help me determine where to go with it. And here is the finished case. And here is 7 years follow-up of panoramic X-ray looking at the bone levels around all those implants. It has not changed 0.2 millimeters.